It's really disturbing. You go into that space to care for patients. You know that their families are under stress. You know that they're worried, and so you come at those situations from a very compassionate perspective, and then to be met with violence. We're there to care for people, so we're not equipped to fight back. We're not in a mindset to fight back, and so you're there providing care to a patient, and then you get kicked in the face, you get elbowed, bit, whatever it is, um, in that space where you're trying to provide care for somebody. You're trying to, um, give them their medication, or provide wound care, or even giving them pain medication, or it it doesn't it's not always like somebody like having a reaction to having an IV started or something uncomfortable. Sometimes it just comes out of nowhere.
What can be done about it?
So understaffing is a major issue in our hospitals, in all hospitals, it seems. And so when we're not able to meet patient care demands, frustrations mount. We're not able to de-escalate situations like we need to when we don't have staffing, and not just clinical staffing, not just nurses and respiratory therapists and doctors, um, but security personnel on the floor. So when you know somebody's a violent patient, you should have security resources at arm's length. They should be available to respond immediately. We shouldn't have to go in and get beat on time and time again. We should have resources available to keep people safe. Hospitals should also have personal protective equipment. And when we think about PPE, we often think about gloves, face shields, gowns, different things like that. But there's personal protective equipment that's available when you are dealing with patients. If you have somebody that you know is going to scratch or pinch, there are rubber sleeves that you can put on. There are Kevlar gloves to prevent bites. And so hospitals need to have that kind of equipment for us in specialty situations when we need that equipment. We need security personnel. We need security screenings when people are coming into the hospital. We need people to know there's a zero tolerance, so we need hospital administration to administer and enforce those policies even-handedly. There shouldn't be exceptions for VIP patients. So just because you're friends with the medical director, you shouldn't get to come into the hospital and make threats and scream at us and then call your buddy and get back into the hospital. Um, there should be no VIP in healthcare, because every patient, when you're a nurse, every patient in that bed, it doesn't matter if they're a homeless person or a millionaire, they're the same in our eyes. They're a person in that bed that we're responsible for. And so we need hospitals to treat patients the same way.